Hello! Kung napapansin nyo na yung anak nyo parang may gustong sabihin, tapos minsan gumagalaw yung bibig nila, pero either hindi natutuloy or walang sound na lumalabas, or kapag napapansin nyo na yung anak nyo may nasabi ng words dati, pero parang hindi niya ito maulit kapag pinapaulit nyo sa kanya. Today's topic is about a disorder na napakahirap pong i-diagnose. But I'm going to try to simplify it just so you can have the main points to try to see if ito ba yung reason kung ba't nahihirapan yung anak ko. So tara, usap tayo. Let's get talking. Hello, if you're new here, I'm Teacher Kaye and I'm a certified speech-language pathologist. Today's topic is about dyspraxia or apraxia, but more specifically, childhood apraxia of speech, which is something that children are born with. And I'm just saying this to differentiate it from apraxia caused by stroke or a traumatic brain injury. Apraxia is a motor speech disorder where the brain has difficulty or completely cannot send the signals to the mouth or parts of the mouth like the lips, the tongue, and the jaw para ma-coordinate nila yung proper production of the speech sounds that eventually become syllables, that eventually become words, and connected speech like phrases and sentences. This could also mean the coordination or the sequencing of signals or commands. And dahil motor component yung affected, sometimes this means that the child actually already knows what to say, has the willingness or intention to say it, pero parang hindi lang nila magawa, hindi nila ma-execute yung proper movements. And if you've seen my other videos about articulation, speech is so many complex oral movements na to us can seem so simple, but if you break it down, actually, ang dami kasi niyang steps. To give you a more specific example, let's talk about the letter M, which I already talked about in a separate episode. So in the steps of producing the sound, sinabi ko na kailangan naka-close ang lips and then ito turn on yung voice, pero yung air dapat lalabas sa ilong. So these are the 3 steps. So to a child with apraxia, baka sobrang hirap nung 3 steps na yon because to close your lips pa lang, your brain needs to send the message to the correct muscles para ma-close mo yung lips mo. And then, iba pa dapat nung isa-send nilang signals for turning on the voice and for exhaling through the nose to coordinate all of that. So, one of the common things na nakikita sa children with apraxia ay yung groping behaviors. Yung para bang nakikita mo talaga yung effort na binibigay nila into producing that one sound pero parang hindi nila magawa. So, for producing the M sound, baka nauuna yung pag-turn on ng voice. So, makikita natin gaganto sila. Bago nila ma-produce yung sound. Other signs you can see as early as 18 months old kapag yung babbling nila ay medyo delayed. For example, masasabi nila yung ba, pero hindi na nila mauulit yon. Or masasabi na nila yung ma, pero hindi na nila mauulit yon. So that is why the trend is from 18 months to 2 years old, pwede ka nang magka-suspicions of apraxia. But it's so hard to confirm a diagnosis of apraxia kasi yung mga signs and symptoms niya ay sobrang similar with other disorders and conditions. So unless specifically parang purely apraxia lang yung disorder ng bata, ang hirap-hirap i-delineate nung mga yon. In fact, 65% of children with autism co-present with apraxia. Typically, it is ideal to assess a child for apraxia kapag medyo okay na yung receptive language and verbal na sila, meaning may nasasabi na talaga silang words. Kasi some of the things that we use to assess apraxia is imitating syllables, imitating words, to see if kapag pinasabi mo yung the same word 3 times, nasasabi ba niyang the same way 3 times? Or every time ulitin niya, parang iba yung tunog. So for example, for the first time, pinapasabi niyo sa kanya mama, pero ang nasabi niya ay ba. Tapos the second time na ulitin niya, ang masasabi naman niya ay maba. Tapos for the third time, masasabi naman niya ba. So, magkakaiba yung 3 attempts niya to repeat the same word. It is also harder for children with apraxia to say a word on command. Meaning, kunyari, in response to a question, tinanong mo siya ng something. So, syempre, kailangan i-retrieve niya yung word, tas sasabihin niya yung word na yon. Usually, they can say words when mas volitional. Like, gusto nilang may sabihin talaga, masasabi nila yung word. Pero kapag ipaulit mo na, di na nila maulit. Another sign of apraxia could be pausing in an inappropriate part of, let's say, a word, like in between a syllable. So, di ba, ang ikli na nga ng isang syllable. But sometimes, even just saying ma, nung tunog nila, magiging So, merong konting pause in between the syllable. And di ba, that's not natural. Sometimes they also have difficulties with the proper word stress. So for example, in the word banana, di ba usually yung stress natin nasa banana. But for them, sometimes they can sound like banana. Or sometimes lahat naka-stress. Banana. So these are some of the ways that children with apraxia can sound to us. There are still no definite causes of apraxia, and in fact, it doesn't usually present with anything in brain imaging scans. But of course, you have your usual suspects, like it could be related to something metabolic, it could be genetic, as in namana, it could be from fetal alcohol or drug use, or it can also happen to premature babies. So what do we do if may suspetsa ka na may apraxia yung anak ninyo? Kailangan nyo na pong mag-seek ng help ng professional like a speech-language pathologist like me kasi kami po ang makakapag-assess at makakapag-diagnose kung apraxia nga yang talaga. Like I said, suspicions may start from 18 months but can only really be more definitively confirmed kapag nagsasalita na kahit papano yung bata. Dahil mataas po yung occurrence ng apraxia with children with autism, usually kapag po na-diagnose with autism, ipascreen nyo na rin po for apraxia kapag may nakikita po kayong mga signs nito. And the most important part of this video is what can we do to help the child kung meron nga siyang apraxia. Because we talked about dyspraxia, if it is a little bit mild, meaning meron lang kahirapan mag-send ng signals, or apraxia, totally no ability to send signals from the brain to the right parts of the articulators. Dahil po ang problema ay yung pag-send ng signals, dapat kailangan natin silang tulungan maghanap ng ibang ruta para makarating doon sa paroroonan. So if you notice from my other videos, I always talk about helping the child make associations with words and the things, but this time it's talking about associations between what they want to happen at paano nila yun i-execute. So what we can do is give them all the cues and all the help para makahanap sila ng detour to those articulators. So that's why in my articulation videos, I teach you ways to cue your child paano magawa yung certain sounds. Kasi yun din talaga ang kailangan ng any child na nahihirapan with speech sound productions. So let's talk about the different kinds of cues. There's auditory cues like what we say para marinig nila, oh, that's what it's supposed to sound like. We have to give them tactile cues, as in hahawakan nyo yung parts na dapat gumagalaw or tumutunog sa kanila. Third is visual cues, so that's using pictures or actual objects to help form more associations for them, na every time makita nila yon, ito yung sound associated with it. And then 4, there's assistive technology or augmentative and alternative communication systems or AAC na napag-usapan ko na in a previous episode. So for a more specific example, balikan natin yung sound. So your auditory cue is just you saying it to your child. Pwede mong lakasan, hinaan para iba-ibang ways niya naririnig ito. So you can start with just saying Pwede mo ring i-up and down to indicate more emotion like and diba that usually means masarap. And then there's tactile cues which I showed in that video, which is touching your child's lips together para alam niyang ito dapat yung magsasara and that is how it's supposed to feel like pag magkadikit yung lips ko together. And then you can also touch their nose para maramdaman nila na dun dapat magva-vibrate. And they can also touch your throat para nararamdaman nila na kailangan may mag-turn on dito sa throat area nyo. And then for kinesthetic cues, as in movement cues. So when you say, pwedeng i-associate mo muna kapag naggagawa nila yung sound na yon when something is yummy. Tapos dagdagan mo ng movement. So, i-exaggerate mo para ma-associate nila itong movement na ito with, when I do this, it means yun yung sound na ginagawa ko when I find something yummy, and then it will form associations, and then makakahanap siya ng detour. All I have to do is replicate or repeat that time na nagawa ko yung sound na yon para magawa ko yung sound. Siyempre, hindi naman sa lahat ng bagay na magagawa siya ng M sound, appropriate ito. But later on, you can wean off the cues. Visual cues. Even you just pointing to the parts of your mouth that are needed to move to make that sound are already visual cues. But it could help if you have pictures. For example, aside from you pointing and saying, if you can have a picture of lips na naka-close, pwede mo hawakan yun so that every time makita niyo reminder yun sa kanya. When you put it near his mouth, magagawa din niya yung or at least he's going to start making that association. But if you're not in the sound production level na, nasa word level ka na, you can also use picture cues to practice their speech. So kunwari hindi pa niya masabi yung word na milk, pero nakikita mong he's trying to do it, get muna a picture of milk so that he can get that every time he wants milk. Bring it to you to provide more opportunities to try to get him to practice milk. Milk. And maaalala niya that the sound is in milk. Now, alam kong medyo divided ang opinions on AAC or Alternative or Augmentative Communication Systems because feeling ng ibang families, ayoko ngang sanayin siya sa use of pictures or use of sign language or gestures kasi baka ayaw na niyang magsalita. But studies actually show na doing this with speech and language stimulation actually helps them practice while they are still learning what to do. I can talk about AAC in a separate episode. And yun na lang muna just to answer some of the most frequently asked questions about the signs and symptoms of apraxia. Kasi ang dami nang lumalapit sa akin about, teacher, yung anak ko ganito, 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 ganito. And already in my mind, that sounds like apraxia. Pero nahihirapan akong i-explain siya just by chatting with you guys. So I hope that this helps. But always remember that this is just to give you more information. Beginner, basic info on apraxia. And it's actually such a broad topic, but I just tried to give you the most important points. And if you notice that your child may have some of these signs and symptoms, this is not immediately diagnosing your child with apraxia. You still need to see a professional. For any other clarifications or concerns, you may message me on my Facebook and Instagram at Teacher Kaye Talks. But guys, hindi ko po talaga sila nababalikan immediately kasi madami po kayong kausap ko. So uulitin ko lang po, please be patient. I do try to read everything. But in reading everything means every single person that I talk to, I have entire conversations with. So natatagalan po lang talaga. And if you like this or found this helpful, I hope na pwede nyo pong i-share ito sa iba pang baka nangangailangan nitong ganitong information. And if you haven't yet, click that subscribe button. I would love to have you in this community. And hanggang sa muli, happy talking and mabuhay!